We have seen this report with our colleague Dr. Noura Al-Naibari, and what marvelous advices she gave to us. We know that staying healthy is very important. Eating healthy, working out, and staying in shape. Yet, we cannot ignore the fact that the percentage of being diabetic is increasing. What is diabetes? What are these types? And what can we eat or exercise to control it? This and more we will know all about. But we have a special guest that will take us through all the questions that you and we here in the studio have in mind. We are here with you, Dr. Thamer Al-Isa, consultant endocrinology, diabetes and metabolism in Jaber Al-Ahmed Hospital and Desman Diabetes Institute. Good morning, doctor.
Good morning. Thank you for having me.
You are most welcome, doctor, and thank you for joining us this morning in our show, Sunshine. First of all, doctor, what is diabetes and its types also?
So diabetes is a medical condition associated with high levels of glucose level in the blood. The body cannot really utilize blood glucose at a certain point during this illness. That creates a lot of high levels of glucose. There are several types of diabetes that we call type 1 diabetes, which is a deficiency or inability of the pancreas, which is an organ in the body, to produce a hormone called insulin. And insulin is very important to regulate our blood glucose levels. Without insulin, our glucose levels will be elevated and we cannot utilize it in the cells to burn it as a fuel for energy. So in type 1 diabetes, they're not able to produce that insulin, and it creates a condition of high glucose level. There's another type of diabetes called type 2 diabetes, and that's the majority of the patients or the people who suffer from diabetes will suffer from type 2 diabetes. And in type 2 diabetes, there is a plenty of insulin, but it's just not working well. There's a resistance to the effect of insulin, and that's created because of the weight gain and other issues related. And that also will create a state of high glucose levels. There's another type of diabetes, we call it gestational diabetes, which is a diabetes that comes during pregnancy, because pregnancy can create a lot of resistance to insulin. And that would also will cause ineffectiveness of the work of the insulin, and that will create also high levels of glucose. There are less frequently or much rarer forms of diabetes that becomes part of a genetic disorders, but the most common types are type 1, type 2, and the gestational diabetes.
Yes, doctor, and I have seen that there are more than 2 types, but what are the symptoms of those types on both or 3 times? We know that sometimes people don't know if they have diabetes or not. So how would they discover it?
That's totally true, because majority of the people who have diabetes have type 2 diabetes. And type 2 diabetes, the development of this disease is very insidious, meaning it's very slowly catching into the people and going in and developing into the diabetes form. So a lot of people do not feel that they have high sugar levels. Some of them might do, and that would create some issues related to being thirsty all the time, going to the bathroom a lot, losing weight, feeling dizzy, tired, inability to do daily activities as well. They could have non-healing wounds. They could have some genital infections, urine infection. So these are common symptoms of diabetes, but not a lot of people will develop that. With type 1 diabetes, because it's a complete deficiency of the insulin, patients do usually develop diabetes, and they will discover that they're diabetic because they do have symptoms. And that usually we see in young kids or young adults who develop type 1 diabetes, because with type 1 diabetes, we usually see it in much younger ages. With gestational diabetes also, we don't have much symptoms. And because of good screening programs, we tend to do a lot of tests on pregnant women to predict if they do have diabetes or not. For type 2 diabetes, because most of them do not have the symptoms, we have started to do screening programs for adults, meaning if you have a parent or a family relative, a first-degree relative who has type 2 diabetes, then you need to be screened for diabetes. If you're overweight, if you're not exercising, if you're not eating healthy, and you're over the age of 40, then you need to screen for diabetes. If you have none of those, and your age is 45, then you also need to start screening and looking for diabetes.
Dr. Thamer Al-Isa, thank you for sharing this information. We're all known. So let me go to another topic. Speaking about the diabetes and about the symptoms, let's go to about the treatment of the diabetes. How can we treat it?
Well, that's a good question. Since the majority of the people have type 2 diabetes, and we understand that type 2 diabetes comes because of lifestyle, so healthy lifestyle, meaning exercising about 30 minutes a day, eating healthy food with low carbohydrates intake in the diet, and try to minimize the sugars as much as possible, and trying to lose weight as much as possible, 5 to 10% of your weight if you're overweight or obese, then by that you can improve significantly the level of your sugar level, and even can prevent you from developing diabetes if you are at the risk of the group of developing diabetes. For type 1 diabetes, it's different, because with type 1 diabetes, there's a deficiency of insulin. So the treatment has to include insulin as a replacement of the missing insulin. And the insulin can be given as an injection forms. There are different types of insulin. There's a short-acting, there's a long-acting, and type 1 diabetics usually have to know, change the dose and use it as they need to for meals and for non-meals. There are other medications that can be used for type 2 diabetes and also for gestational diabetes that comes with pregnancy. And they could be pills and they could be injections also. And we have a lot of these therapies and we can use them for a lot of our patients.
Yes, doctor. And you have talked about the diabetics and high blood pressure. But sometimes I know, because sometimes me also, we have a low blood sugar and we get dizziness. So can you explain to us what is it and what causes it and how can we really avoid it?
Okay, it's a big topic, but if it comes in the context of treating diabetes, then most importantly, what we need to do is that make sure that the therapy that we're using for diabetes is not causing the low blood sugar. And if that's happening, then we need to consult our physicians and make sure that we adjust the medications and the diet so we can avoid the low sugar levels. If the low sugar level develops in a patient who does not have diabetes at all, then we have to look for a cause. It could be diet related, meaning if someone is skipping meals or completely avoiding to use any kind of carbohydrates, which are the healthy types, especially the ones that come with fibers, like whole wheat, the kinds of carbohydrates. So someone is skipping meals or avoiding to consume these kind of items, or engaging in a lifestyle that includes heavy activities, working out for a long period of time, or working for a long period of time, especially if it includes movement, then that might put them at risk of developing low sugar levels. So we need to look for the cause, and if we think it's related to the lifestyle, then importantly, we need to fix that.
Dr. Thamer Al-Isa, let's go to another question. It's about our final question. So, doctor, with the emergence of COVID-19 virus, could a diabetic patient be more vulnerable in terms of being infected, and also why?
So it's a very common question. We get that a lot from our diabetics. We don't have a proof yet to tell us that if you have diabetes, then you're more prone to develop COVID infection. We still don't have that clue. What we can say is that if you're a diabetic, especially a bad diabetic, unfortunately, and you develop COVID infection, then you have a higher risk of developing complications related to the COVID infection, more than someone who does not have diabetes. And we've seen that patients who develop diabetes or develop COVID infection and they're diabetics with a poorly controlled diabetes control and high levels of glucose, that even puts them at higher risk of developing complication compared to a diabetic who has a good control. So it's important that diabetics in general, especially if they do have other medical conditions. So if a diabetic have a heart disease, a kidney disease, then these medical condition, extra medical condition, could put them at risk of developing COVID infection, especially if they're elderly people, then also that adds into the problem. So we tell general recommendations about safety, wearing a face mask, washing hands, and using sanitizers. That's for all our diabetics, especially if they're older and have multiple medical conditions. If you're a diabetic and you want to keep your health safe, then you need to control your diabetes so that if you get COVID infection, you don't develop complications.
Nice, Doctor. Already reached the end of our episode about our interview segment. Thank you for sharing this information to us and for everyone who's watching us through the KTV2, the family channel. Thank you so much, Doctor.
Thank you so much.
Thank you so much for being with us today in our show.